All right, our recording is now in progress. I didn't forget. Everyone give me a round of applause. Send me a clap emoji in the chat that I did not forget to press record today. All right, so I want to welcome everyone to our live. Today we're going to be talking about anxiety and OCD. We're going to talk about the links between those two things. We are going to talk about how anxiety can start to present like OCD. We're going to talk about different types of OCD. And we're just going to cover as many topics as I possibly can think of. I am Dr. J, if you haven't met me or seen me live talk already. And today I'm bringing with one of my patients. Her name is Carly. And Carly is a patient of mine who has gone through my program, Piece of Mind Method. And now she is here on the other side. And we're going to talk about how we've improved anxiety symptoms and OCD symptoms during our time together. Okay. So like I mentioned prior to hitting record, nothing that we talk about today is going to be medical advice that I am personally giving you. These are all going to be things that I've worked on personally with one of my patients, just to give you some guidance and to see how things have changed over time when we actually have been treating it with things that we also use to treat anxiety and the improvements that we've seen. But I don't want any of you to, go off after this and be like, I know what I'm doing. I'm the master of my OCD. I got this. And then take whatever treatments we talk about today or whatever lifestyle interventions we talk about, because then we can land ourselves in a little bit of muddy water when it comes to the OCD, because OCD and anxiety are very linked. And OCD is like, I like to call it a precious type of anxiety. We don't want to start playing around with it too much because it can create a big emotional response inside the body and inside the mind that it is really important to have someone on your team and on your side while you go through this stuff so that you understand what to expect and how to actually work through those things when they start to get a little bit overwhelming. Okay. I'm just going to pop into the chat right now and see if we have any more questions before we start. We got hand washing going on. I have a clap from Julianne. I'm so happy to see some of my patients in here in this live right now. Hopefully we'll have some good juice to share while we chat. All right. And if you are sending a message in the chat, make sure to click that link that says everyone so that we're all getting the message. Unless you want to particularly send a message to me, then that is cool too. Okay. So I'm just going to start off by saying, Carly, welcome. Why don't you let everyone know, what's kind of been your story of going from anxiety to OCD? And then you can give us a little bit of background on what your OCD personally has been like prior to working with me.
Cool. Thanks for having me, Dr. J.
My pleasure. Love it.
My name is Carly, as you know now. I have been struggling with anxiety and OCD for a long time, but I didn't know I had OCD until I met Jenna. So that's great. I just thought it was mostly anxiety based for most of my life. I've done therapy before. And then I've never done something like the Peace of Mind method, and it was amazing. And Dr. J helped me a lot. So yeah, I feel like I was struggling for a long time. Let's put it that way. And now I feel so much better. And now I'm here today.
So why don't we talk a little bit about initially when we started talking, we were able to find out that you had OCD tendencies pretty quickly. So let's talk about your personal OCD tendencies and how they started even before we were working together. Like go back in your memory and think about what kind of tics you had. And then we'll talk about the real definition of OCD after we talk about that. Because I think people who are listening to this right now or even attending live already know what OCD means in a general sense. So they know that people have these habits that are happening behind the scenes. So let's hear about yours, and then we will talk about the real definition of what it is.
Okay, so looking back now, I could see my symptoms starting like back in high school. And I was obviously I was a very anxious person back then. And I felt like everything I did had to be done in a certain way. It had to be perfect. And I was like that for a lot of my life. And I feel like some of my tics, like for example, other people could probably relate to this, locking the door, make sure the door's locked, checking the stove after I use it to make sure the stove's off, like multiple times. And these were things that I was doing in like maximums of like 2, 3, or 4, and I had to do them like perfectly that way. So for example, like I would I'll do the light switch. So I would like shut the light off. And then in my mind, it'd be like, you have to do that 4 more times. And I was like, okay. And
Or else
something bad is going to happen.
yes,
all the time. And me not knowing what it was at the time, I was like, oh my God, I gotta listen to what my mind is telling me. Like, and obviously, like looking back, I'm like, I'm not psychic. Like how am I not turning off the light switch 4 times affect something that's going to happen? Like it just doesn't make sense now looking back to it. But at the time, obviously, I was like, listen.
Mm-hmm. We have Julianne saying hashtag relatable. Yep, the light switches. So light switching is a big one. Locking the door, big one. Checking the stove, big one. Checking hair straighteners and hair curlers, big one.
I see memes of that all the time, and I'm like, no, that's real. I did that.
Yeah, it is. What about other stuff, like inside your room, would you say? Because I remember like back in the day when we were doing our initial consultation, you talked about order in your room, like reorganizing surfaces and places that like weren't perfect, but perfect would never be reached. It was just like you had to do it a certain number of times to feel that feeling of perfection. So what else did you do, like random tics that are personal to you and not the overarching, I have OCD and now we lock doors 5 times?
My room is immaculate. Everything is in a certain place and it cannot be moved. And if it is moved, I will go and move it back to where it's supposed to be. Like my bed has to be made a certain way. The amount of pillows I have on my bed, my perfume stand, like the perfumes are in a specific order, like that kind of stuff. And I was doing that all the time. And I would get so mad if someone came in my room and like sat on my bed or moved something. And I'm like, oh my God, like it's getting so frustrated. Like obviously not knowing why I was doing this at the time. Yeah.
Now, how many hours would you say that this was actually taking from your time? Because when we look at a diagnosis, what we're really looking at is this symptom and, you know, potential mental health condition actually reducing quality of life? Because if you're someone out there who has anxiety or depression or OCD and whatever, and it doesn't bother you, then it's not diagnosable because you would never reach out for help and be like, what the fuck is going on, right? So if it doesn't bother you, then we don't have that lower quality of life. So how many hours a day would you say that this stole from your day or even stole from your peace or elevated your anxiety?
I think if I were to like total everything up, at least a few hours. And I know people have it like way worse and they struggle a lot more and takes up a lot more of their time. But even like just those few hours a day, like I feel like it was interrupting my life and the things I was trying to complete, like in my daily routines. Like I would put things off because I knew it would take me so long to do. So like, for example, like doing the dishes, I know like, I'm like, oh my God, I don't want to do it because then I have to do this and I know I have to do it a specific way and it's going to take me 10 times longer. And like, I remember like my family like kind of thinking like that was lazy in a way because I was like didn't want to do anything or didn't want to like clean or do that. And I was like, no, you don't understand. Like it takes me so long to complete these tasks when you can just do it and it'll take you like 5 minutes.
Anyone else finding this relatable out there? How many hours is this taking from your life? For whatever tendencies you have, how many hours would you say are devoted to whatever patterning that you've created? Okay, you don't have to answer that. You can think about it in your mind, but if you want to leave it in the chat, go for it. Now let's get down to the definition of OCD, right? We all know, or I hope that we all know, that it means obsessive compulsive disorder, right? And the way that that works is it goes from the obsession, which is that mental rumination of whatever it is that you need to get done, which then turns into a behavior, okay? And what I always describe to people when they do come to me with OCD, and they'll be like, you know, I just don't know why I'm doing the thing. Like, why does it have to happen 4 times? What is it with that number link? What is it about the light flicking? Why is this happening to me? And I always describe to people that between the O and the C, so the obsession and the compulsion is a whack load of anxiety. Right? So we have the anxiety already present in people's lives because most people with OCD already have that generalized anxiety. And then we have this pocketed, controlled, anxious state that is going to present itself every single time the obsession arises. So every time you left the room, you were like, I have to turn off the light. And when I go to turn off the light, I'm now thinking the light's not off. Or if I leave the room without doing this, the obsession, that cycle starts inside the brain. And then we have this very, very high level of anxiety that leads to the behavior of going deep, 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 right? So if I said to you, I want you to just leave the room. I want you to do it once and then just leave the room. You're good. You got this. Leave the room. Carly, or insert whoever your name is that's listening to this, if you leave the room without doing the compulsion, you are left with this pocket of anxiety that has nowhere to go but grow. Okay. And this becomes a really big problem because it can not only take us throughout the rest of our day, which leaves us anxious about the fact that we didn't turn off the light or didn't do that for the rest of our day, but it can also create panic attacks. And it can create a lot of personal discomfort inside of your body that starts extending past an anxiety attack or an anxious response, right? So there is a lot more to the picture than someone just saying, okay, just, click the light on and off once and then just go, right? The same way that we don't just say, okay, you're going to check the straightener once, unplug it, and say to yourself, I unplug the straightener, and then leave, right? Because the second you leave that situation, your mind is telling you that didn't happen. That didn't happen. That did not happen. You never clicked your finger against the light switch. You never unplugged it from the wall. You didn't do that, right? And then we get stuck in this betrayal cycle in our body and our mind of, I thought I did it, but I didn't actually, and now I'm not sure. Right. So it creates a lot of body mistrust and brain mistrust at the same time of like, am I in my life? Am I not in my life? Am I being mindful? Am I not? Am I here? Was I there? And I think that that is also a creator of anxiety around OCD, because if you can't trust yourself, how are you going to trust anything and anything ever? So I think it's a very difficult emotional state to be put in. So we have the OCD traditionally, which is the in numbers, and the behavioral patterns. So 3 times washing your hands has to be done every single time you wash them. Clicking that light switch 5 times. Locking the door 3 times. And usually we're seeing it in that number style. For some people it's 3, some people it's 5. I know people who've had it 21 times. Okay. Wow. So there are people out there that are doing it over and over and over again because no one is teaching them how to sit with the anxiety pocket that occurs between the obsession and the compulsion. And that's where I start to do work, and where we've done our work together, of how to change that experience of having the obsession thoughts. Because you can have the obsession thoughts without doing the compulsion behavior if you know how to tolerate the anxiety in between, when you have the skill set to do it. If you don't have that skill set, then it is impossible to say to yourself, I closed the door. You can't. You will be driving back 2 minutes later to your house and being like, didn't happen, because the thought feels very real. Okay. So that's our OCD. Our OCD is the patterned behavior. Then we have OCPD, which you described really well at the beginning without even knowing it. But your OCPD is obsessive compulsive personality disorder. Okay. So we are not having behaviors in rounds. So no 3s, no 5s, no obsessive tics, which I call them tics, which are your personal behavioral patterns. Instead, it's the personality tic. So it is the version of you who was making the bed and not letting anyone sit on it. Wanting to have a close friendship, but the person's doing something that you're not in control of, and it makes you so uncomfortable that you're like, I just can't hang out with you anymore because like I can't stand the way you chew. Right. So there are differences in the OCD versus OCPD, but there's a lot of overlap. And I think that a lot of people with anxiety, which is, I love to call it the disease of being, out of control. When you don't have control, you start freaking out. It's where we start seeing that blend of the OCD type thinking and the obsession thinking mixed with the anxiety, but in the personality way. So not letting people move your things, not lending things to people, being super perfectionist. And I work with a lot of high achievers who are already perfectionists in general, but we see an even more, it's an obsession with being perfect, cleaning the room so many times until it feels perfect to you. And it doesn't have to happen in a certain number of times. It just needs to be perfect. You'll walk over and you'll like take your water bottle and be like, no, that was too many millimeters. Oh wait, no, that was too, right? And it's like that obsession with the perfectionism is where we start seeing the OCPD. And in that diagnosis, we see a lot of relationship struggles because it looks like from the outside in that that person is just obsessed with control and always needs to have everything their way, and they can't compromise, and they don't or they're not able to have empathy for other people because it's their way or the highway. Can you, if you're feeling comfortable sharing, not just with you, but even anyone in the chat right now, if you want to share, has anyone ever mentioned to you that like they always feel like you need to be in control and, you know, things always have to be your way or the highway? So if that does sound like you, then maybe we are working with OCPD. And that's where we're just seeing this rigidness of a personality, because when you let go of that control or let go of the rigidness or give a confounding variable any power, it makes you so anxious that you have an emotional outburst. Okay.
100%.
And that's the same diagnosis criteria when it comes to OCD and OCPD, which is when you can't keep your obsession at bay, or someone intervenes with the compulsion. So for OCPD, it's control, and for OCD, it's flicking the light switch, for example. If someone gets in the way of your compulsion, then you go emotionally bonkers. Okay. So I'm going to try and look through the chat right now. I'm seeing, yep, sounds a little bit like me. Yep, 100%. And that is important to understand, because if it's the compulsion, the interruption of compulsion that's creating the emotional response, then you have two jobs. One, to work with the anxiety that's coming up, that's creating the emotion, and then dealing with the emotion that comes up. And I know that in the program, when we work together, there is modules where we are working on the anxiety piece and how to sit with her, like the physical sensations, to sit with the emotional sensations, to practice non-judgment, to do all that stuff. But then we get to a point later on in the program where you're actually having to navigate the difficult emotions by using your tet, right? Using your brain. And you have to sit there and go, okay, I feel it. But what am I going to actually now do with that feeling? Because you can't keep it inside. I always tell people, when you keep feelings inside, they just fester somewhere else and they create, you know, giant problems elsewhere. But if we're able to feel the anxiety, experience it, hold it with ourselves, acknowledge it, and then choose how we're going to engage with those types of things, that's when we see big changes to a mental health condition like OCD and OCPD. Okay, so if some of you right now are, again, self-diagnosing with OCPD, don't go there yet, because there's certain criteria that we have to hit. And there's different types of treatments and therapies and tools that we use to work with these things differently, even though they have common ground, right? Like, for example, in your treatment with OCD, because you had those tics, we're treating it with natural medicines. But when it comes to OCPD, that is completely personality and behavioral choices. So we have to learn how to do the mental and emotional work aside from treatment, because treatment's not going to help. Maybe treatment with the anxiety is going to help, but there needs to be more behavioral controls and tools being used there. My hands are really doing this motion today. I wonder what about OCD is making me play Dragon Ball Z. Okay. So we've talked a lot about how anxiety is a component of OCD, you know, for you specifically and all people in general. And we've talked about the behavioral presentation of OCD. So let's kind of now break it down to what physical OCD and mental OCD is like. And how would you describe your physical and your mental OCD, where they differ? So we know you're physical right now. That physical, you know, the tics that we already talked about. But what's happening inside your brain that you obsess about frequently? What's the thought cycle that you get caught on in your head that has nothing to do with the physical outburst, but something that you can't stop thinking about?
Oh, for me, oh wow, lots. For example, like I would always think that, like I said earlier, something bad is going to happen. And it was usually like something bad is going to happen to a family member. And I just felt so responsible for that, which is why I had to complete the task or do the thing, like my tic, however many times, right? And then I get that kind of relief that I'm like, okay, I did it. I'm good. I can move on. Like nothing bad's going to happen now to that family member. And then I would feel good about it.
If If the mental obsession was something bad's going to happen to this person, did you ever have conversations with them and try to control what they were doing so that your mental, let's call it the mental obsession, would ease itself a little bit?
No, I never did.
Okay. Maybe some of you listening are like, yep, that is something I do. You're like, okay, if I don't, flick the light or whatever, or you have a thought in your head, a random intrusive thought that says, my family member is going to get in a car accident today. Do you start obsessively calling them, being like, I want you to be safe on the road today. I want to make sure, this is for other people in the chat right now, I'm making sure, that they wear their seatbelt, that everything's good. I want them to text me when they're at the location. Like if we start to have these behaviors that are in alignment with the obsessive thought, then that's mental type OCD, right? We're still trying to control it and we're still trying to get our yayas out and deal with our anxiety, but putting it onto other people and other things. And then I also have patients who have a lot of mental OCD and no physical tics. And mental OCD is the obsessive thought about self. So the obsessive thought that if you do something, it's going to cause this, and then ruminating about that thought so many times, have an anxiety response, and then having behavioral outputs that are in alignment with that mental thought. So when I say thoughts, I mean rumination, obsession, can't stop thinking about things. I don't want to allude too much to things that people have ever told me, but I know that some of my patients work through having obsessive thoughts about people in their lives, right? How outcomes are going to happen. And they become really obsessed with the fantasy of what their brain is creating inside their mind. And it's causing actual anxiety and behavioral changes in themselves. Not leaving the house, isolating, crying a lot, not eating, whatever it is that they're doing, there's a mental type OCD. Just because you don't need to flick the light 10 times doesn't mean that you don't have to cycle through a thought 10 times. And I always ask my patients this question: if you are going to have a thought and you don't have the outcome immediately, why do we have to think about it 10 times? If we're not gaining any new information, how are you suddenly going to come to the thought or the answer on the other side without more information? Which is exactly the same thing as no matter how many times you turn off that stove, it's still going to be off.
Yeah.
Right? So I think that it gets confusing when people are looking at themselves being like, do I have OCD or not? Or do I need to treat my OCD or not? Because they think that OCD has to have this physical impression of having a tic. And you can have mental tics. So let me know in the chat right now, is there anyone in here that thinks that they might actually just have that mental cycle of OCD instead of having any of the physical traits that go along with it? Because I'm sure you all know that when we do diagnosis, we look at the DSM-5 and we try and find certain parts and categories that actually allow us to diagnose and treat someone with a condition. And usually in these areas, what happens is it'll say, 2 from this category and 3 from this one. So we can have different presentations of OCD. And I think a lot of people miss treatment opportunities because they're not having the archetypical symptoms that come along with these conditions. Yes, let me just make sure I look in the chat right now. We got mental and physical tics. Yeah, we do. I mean, I'm here live with Carly. We got both. Yeah. Yes, I expect to get a text that they say they're okay and home safely. Okay, what happens when the person doesn't respond? Do you have an emotional outburst? That's the ticket right there, right? You're giving in to the thought. Great, we can call it I'm worried. But if the person doesn't answer in a timely manner at which you want them to answer, is there an emotional outburst that comes after that, right? So that's where we're starting to look at cycles being broken and what happens when we go to do that. So imagine, for example, you have these mental tics where you need to ruminate through cycling thoughts, and I look at you and I go, we're never going to address it ever again. You'd go crazy in your mind. You'd be like, I'm gonna go crazy and I'm gonna spontaneously combust and I don't know what to do about it. And that's where treatment, in my opinion, with other practitioners I've seen fall short. Yeah. So since I have a lot of people in here who have obviously, I think, let me know in the chat right now if you've actually gone to a therapist or a professional before with your OCD, because I'm going to talk about some bad things that I've seen practitioners do, and we're gonna talk about that a little bit. I start to freak out in my head and get physical symptoms. Yes, because we have anxiety. Okay, so this is something that has bothered me when patients come to me and they'll be like, I've been seeing a practitioner for, a year and I'm not seeing any changes to what's going on. They've taught me some really valuable things and they share them with me. And I'm like, how is that valuable? Okay. And Carly doesn't count here because she did not see anyone before me. So we got off on such a clean slate that she was just like bang, bang, boom. Moving through my program, she did everything I asked, how I asked, in the complete perfectionist manner that she operates all the time. And she came in on the other side with like poster child results. And that's why I have her here with me right now, because it was so easy and not everything is going to be this easy for everyone. But I do want to say that, if you've gone to a practitioner before and you've gotten this advice, it's not your fault. This is what people are trained to do. And I think it's because they don't have the familiarity with OCD and they kind of get uncomfortable with it and don't know what advice to give because they don't have it themselves. So they don't know how to sit in that pocket with you. But I've heard practitioners telling their patients, depending on if they're a doctor or not, saying, I just want you to care less. Easy. And I'm like, oh, okay. So I have a patient who needs to turn off the stove, what used to be 10 times, and now we're reducing it to a reasonable number that works for her. Okay. Whatever that is. Imagine someone looking at you being like, but the stove's off. Why do you care? We just need to work on caring less. Like if the stove is on, then, let's look at the worst. I mean, the worst is pretty bad here, right? You're going to have an anxiety attack that your house is going to burn down. You're going to kill everyone inside of it. And you're going to be the only one left to live. And you're going to have to go on for the rest of your life. You could make up any tragedy that you want right now, right? So I don't like when practitioners say to people, we need to practice, caring less about that thought. The thought's not real. And I hate when practitioners say that a thought is not real, because what is more real than a thought, right? It doesn't mean that it's true, but my goodness, if you think something and can make your heart race, what's more real than that, right? It's real. It's like telling a kid that the monster under the bed or in the closet isn't real. And they're like, I get it that you're telling me it's not real, but it feels real. And that's the only thing that the person is experiencing, is the feeling. So let me know in the chat if you have been told before that, your intrusive thoughts aren't real, and that you should care less because they don't mean anything. I don't like when people say that they don't mean anything, because yes, it's true that you are not a psychic. You do not have intuitive powers, and you are not predicting the future or creating a problem or manifesting or whatever people think inside their minds of, my thoughts mean something greater than myself. They don't, but they mean something to you. And it's about how you organize that discomfort and practice, the non-judgment that we worked on in those first few modules. As we work through mindfulness and we work through meditation and we work through breath work, you started learning that you could have a thought and it could be uncomfortable and it can feel a certain way, but you're not going to place a story on it. And that is where we start to see some magic with the anxiety and OCD, which is you can actually observe a thought with complete neutrality, and it can be spontaneous, and it doesn't have to mean something, higher power and surreal, but it can be a feeling, and you could acknowledge that feeling without acting on the feeling, when non-judgment thoughts are what follows. And it's impossible to learn how to practice non-judgmental thinking without learning mindfulness and meditation. Sorry to swear, fucking possible. Okay. There is not one human on this planet that knows how to practice non-judgmental thinking who does not meditate. Because when you are practicing and brain training and consistently coming back to, I hear you, I see you, I feel you, but we're going to remain here without the external narrative of, but, that's where you can start to take that skill of the mindfulness and the meditation outside of it. And we don't have to right now talk about, we will get to how, you practice meditation and how it changed from before to when you started working with me and that kind of stuff. But this is my long-winded way of saying, I don't like when people say it doesn't mean anything, because it means something to you. And it's a very degrading way of saying your feelings don't matter in like a weird roundabout way. And sorry to break it to you practitioners out there, but your patient's feelings are the only feelings that matter. So that definitely has bothered me when people bring that type of information. Another thing that really bothers me is when practitioners and people, whoever are listening right now, people in your lives who try and rationalize the thought that you have.
Yeah.
Like if you have a thought in your head that, your family's not going to be safe, what help is it for someone to say, oh no, they'll be fine? Like, thank you so much. If I thought that, then I would just think that, but I feel different. Or if someone says to you, okay, you don't have to lock the door again because logically you locked the door. It's like, I get it. I logically locked the door, but I don't feel like I did. And that's where I just don't respect practitioners who try and rationalize a very irrational thing. Feelings are not rational. It's like being in love with someone you're not supposed to be in love with. It's like, well, you love who you love. Like, even if they're a bad person, you're like, oopsies, I'm in love with them. It's a feeling. If everything was rational in this world, then we would have so much order and so much predictability that we wouldn't even know how to function. We would just be robots, right? And that's not the ticket to life. And it is not the sensation you're having, because all of you listening right now who have OCD and anxiety, you are highly emotional creatures. And I get it, right? I mean, I have anxiety and depression. I'm a highly emotional creature. So I get it. And it's not very helpful when someone is trying to say to you, that doesn't really make sense. It's like, thank you. I understand that. That's why I'm here, to get professional help for someone who's going to help me navigate the root cause, which is always discomfort. I can have an intrusive thought or a irrational thought that there are ghosts in my house or a spirit sitting next to me. And it's not about finding out whether that's true or not. It's about, if that makes me uncomfortable, how do I learn to sit with that discomfort? Right? And that's where we start to see again that magic and the beauty with non-judgment thinking, with meditation, with breath work, with mindfulness, with yoga, with all the stuff that we did at the first part of the program. And I, not many of you know about Peace of Mind Method, or maybe some of you do, but it is the way that I work with my patients in the background when I'm treating them. So me and Carly were working on the OCD in one-to-one sessions, but all the other weeks that we didn't see each other, she had homework and stuff that she had to do, and get to checkpoints where I said to her, okay, are we seeing changes because of the things you're doing? Let me do my work as a naturopathic doctor and we'll treat whatever we need to treat. But it's not my job to make sure that you're actually putting in the work on a daily basis. So let's talk a little bit about the mindfulness. Let's talk about meditation first. And then we'll move on to the breath work, and we'll move on to the yoga and how that kind of stuff made its way in. But how did it teach you how to sit with the discomfort in the moment so that you could find space between the obsession and the compulsive behavior? Take the floor.
Okay, thanks. Well, before doing your program, I was meditating, but it was more like meditating like on the apps, like the quick ones. And I feel like I wasn't like fully into it. I don't know, because they were so quick, you can't really focus. Like it takes me probably about like 5-10 minutes to actually
get
into it and focus. So like by the time it was my 5 minutes was up, I was like, oh, okay, like whatever, like I'm done. I think then doing the meditations in the program, they were obviously longer. And at first it's like, oh my goodness, like how can I sit here for 20 minutes, like in silence, when my mind is going like 1,000 miles a minute, right? Just with thoughts. And obviously a lot of people here are probably like, yeah, like that sounds hard. And it is hard at first, like as you do it. And this is something that you put into the program, and you got to choose like however many days you want to do it for. And I was like, hey, you know what? I'm going to do 7. I'm just going to go for it and do 7.
Yeah, because she's a 10 out of 10 perfectionist.
And that's the thing too, like you have to be fully invested in it and like want to change, right? And like that's how I felt. I just had enough and knew that that's what I wanted to do. So okay, so I did it 7 days a week for 20 minutes. Well, I started 15 to 20 minutes, and like now I'm up to 20-30 minutes. And I know like that's a lot of time for some people, and I'm busy too. Like I work, I do things, but this is my non-negotiable every day. And I feel like it's definitely helped like with my anxiety and my OCD, just like the meditation sitting there. And obviously I'm not perfect. Like I don't have no thoughts when I'm meditating, but it's just so nice to just sit there in silence. And that's another thing, because I didn't like being in silence too before this.
Literally every person with anxiety is like, I hate being alone with my thoughts in
Yes,
silence.
and that's the thing, right? So meditation is probably so scary, and like I was scared of it too. That's why maybe the 5 minutes is like, I'm still doing it, right? And I'm like,
I'm safe. I'm safe.
I'm
It's
safe.
done.
Yeah, I'm good. Yeah, exactly. So now doing it, it's like something that I do in the morning. So like I wake up and I'm like, okay, this is nice, and I actually enjoy it. Obviously, it's still hard, and thoughts come through my head all the time.
So
But
much hard. Every day is hard.
Yes, every day is hard, but you just learn to sit there, and it's so nice.
Okay, I have a good question for you.
Yeah.
Okay, so have you ever sat in a meditation, obviously during the program with me, and have you had an obsessive thought pop up where you had to resist the urge to do the compulsion and instead sit with the pocket of anxiety that exists between the O and the C? And how did that feel for you? And how was that skill translatable to outside of the meditation?
Definitely. Lots like throughout the program, 100%. I was getting like these thoughts constantly. And just when you sit there and your anxiety, like it does go away. Like I know that's hard. Like if I would have told myself that like before I started your program, I would have been like, yeah, right. Because I knew how I was. I was constantly like, I didn't do that thing. And I would constantly think about it. I'm like, oh my God, my anxiety is not going away. So I'm going to do that thing to make it go away.
Exactly.
And I never sat with it right before. And I didn't know like what to expect, but it does fade. And it's crazy like to see that now after the meditation, the mindfulness, which was another hard thing for me. Doing it, the mindfulness every day and just being in the moment. I had a very tough time being present. I just felt like I was always zoned out. Thinking about things I need to do. I did the light switch. Yeah. So I feel like I was very like not in the present moment. And the mindfulness part was definitely challenging. And I told you that was probably one of my most challenging things. And because we had to do it so often a day as well.
Yeah. So what happens when you had the moment of in the meditation, oh shit, here's my obsession. And now in comes the anxiety. And now here comes my need and burning desire to fulfill my compulsion. What happens when you sit for 20 minutes is not only does it vacillate, you're like, oh, it's so strong. It's so strong. I'm never going to get past it. This is never going to go away. And then suddenly it's like, and you're like, that was weird. Where did it go? Oh, so right away from the beginning, you start to learn patience because all things are temporary. All feelings are temporary. Think about a time where you were so mad about something in your life and ask yourself right now, does it actually create the same amount of anger? No. Were you able to get over it? Yes. Emotions are temporary. Okay. So if emotions are temporary and you can create space for yourself and patience to let it shift and change, then you've actually created enough time for you to learn and gain confidence that you actually can sit with that emotion, right? And I think the thing with OCD, particularly, and with anxiety, which I'm sure most of you will already understand and know this all too well, is that there's not a lot of time between thought, emotion, action. It's just like, and you can't stop yourself. And you're like, I don't know why I did that. It's like, obviously, it's because you are not training your body and your brain to be patient, to sit with yourself, to feel the thing without engaging with it. You can feel something and show yourself how to hold space for yourself without flying off the handle and doing whatever it is that you need to do, if you are patient enough to watch it shift. Because when you can watch it shift and you gain that confidence, you're like, oh, well, I did it that time. So why is that different than doing it this time? And then you can select, do I want to engage with that type of restraint today or do I not? There are times where I'm like, you know what? today I'm going to be the master of my emotions. I'm going to be my best self. I'm going to do what I got to do. And like, I'm having a good day and I'm like, I got this. And then there's times where I'm overwhelmed and have a bad day. And I look at myself and I'm like, Jenna, unfortunately today you shall be your worst self and we will not be showing restraint right now. And like, I can observe that and not judge it.
Mm.
I don't go down a spiral of being like, oh, my anxiety is taking over. It's so bad. I'm a bad person. It's like, well, shit, people have, slip ups and accidents and, behavioral outputs that they didn't mean or intend to happen. And then there's moments where you choose, I'm just going to engage in the light flicking, or I'm going to engage in the emotional outburst because it feels like I need it right now. And that's okay.
Yeah.
And there's this compassion that you can start to show yourself for, okay, I have meditated for the 15 minutes, 20 minutes, 30 minutes, and I was experiencing that discomfort. Now that I'm done, if the feeling is still there, I get to choose and select if I'd like to engage in the compulsion or not. And I've said that to you multiple times before. Like, if you're feeling the discomfort, as long as you've had the internal dialogue of would I like to or would I not? Because you're not looking to live a life where you never have a tick ever again, or never have an emotional outburst again. Like, sorry, we are not, again, robots. We are human beings and we have bad days and bad months, and we can't always be at our tippity top best. But what it does give you the opportunity to do is create space to select. And that is an amazing place because it gives you power.
Yeah.
And there are not a lot of practitioners out there teaching people how to take control and have power over themselves and be okay with when they choose the thing that feels less desirable.
Mm-hmm.
Even if you've selected it twice in a week, that's a win, because your emotions are not things guiding you. It's your intellect and your choice. And if you choose it, it doesn't make you anything less than or bad. It's a choice and it's okay. Every choice that anyone ever makes is okay. Obviously I get a lot of patients that come to me and they'll be like, I don't want you to judge me. Like, I did this. I don't want you to be mad. I'm like, why would I be mad? You're telling me that you had the conversation with yourself and that you made the selection to do what it is that you need to do. And if that's not growth, I don't know what is. Right? I mean, again, you're the poster child who I worked with and you were like, they went away. Granted, we did treatment to help with those types of things. And we will talk about that because I know I don't want to keep everyone, for longer than an hour. So let's talk about first. I'm going to ask in the chat too, because I know that you haven't been prescribed medication, but how many of you in here are on meds for, anxiety, OCD or OCD specific? Because we're going to talk about how meds are generally prescribed. And the best treatment that we have for OCD, funnily enough, is anti-anxiety or antidepressant meds for OCD, right? So it's already verbalizing to us that there's an extension of the anxiety and the OCD. And what these meds are trying to do is reduce your stress and your overwhelm from a top-down perspective of, we're going to chill you out with whatever med we want, and we're going to hope that your tics reduce, right? So I'm sure that there are people listening or people in here right now where they're like, yeah, you know what? The meds actually did help reduce my compulsions. But I would say I work with a lot of people who are on meds for that type of thing. And it's helping with the anxiety outside of the tic, but the tic's kind of still happening and they're just like not engaging with it. Maybe it was able to get a little bit better. But the work that we were able to do with natural medicines is we were able to not even work in the same pathway. So I wasn't actually trying to shift your anxiety with the plant medicine that we chose. I looked in the research to find a plant medicine that worked specifically for OCD tics. And we don't know the mechanism of why this plant works. We just know that by accident, somewhere along the way, someone took it and they were like, well, that's weird. My OCD symptoms started getting better. So they started doing clinical trials and they were able to replicate this result of people's OCD symptoms getting better without dealing with the anxiety component. Okay. So that was pretty cool that we were able to find that. And we can talk about, what you've tried as well, just so that everyone knows what plant medicine you're currently on and how it changed it for you. So why don't you share with them what you're currently taking that was prescribed by me?
All right. So like just for the OCD?
Yeah.
So she prescribed me milk thistle, which is wonderful. It's awesome. And I feel like it definitely helped me a lot, but also it's the other things too that you're doing throughout your day, like the meditation, like the mindfulness, like the breath work, that work together to actually really help. And like you were saying before, when people are just prescribed medications and not doing anything else, like you don't get the full effect, I feel.
Correct.
Yeah.
Health is very interesting. I wish we could say that, you know, if I always say mental health is not a simple situation. There's so many layers to it. And every time I say that, I resist my Shrek and Donkey joke about, you know, onions and layers. But there's so many different places and avenues that you have to tackle when it comes to mental health, because there's all these circles and pillars that are contributing to the culmination of a symptom. And we can't just pop a pill. That's why you can't just take an antidepressant or an anti-anxiety and be like, yay, my OCD's gone. Like, it's not going to work that way. You have to hit these different angles. And that's why when I work through the program and the order that I have it in, there are so many different pillars that we're hitting that by the end, if you don't see an improvement, I can look at you and be like, well, maybe the work that you put in wasn't actually there. I have never seen someone work through the program and not see crazy benefits on the other side. I mean, granted, all the people that I work with are that high achiever type of person. So they're always willing to engage in the things that I, you know, challenge them to do. So that's where, you know, I get the beauty of being like, oh, it works. It works because the people I work with are doing the work. And I always tell my patients, this has nothing to do with me. I'm not like some guru who knows everything where I'm like, you know, you got to do these things and follow my way and everything will be good. It's like, no, you need to do your work. You need to take and extract the lessons that you learn from the teachings that I provide to you. And then you need to create that consistency and that effort. And you're going to have the confidence at the end of the day to see the changes on the other side, right? Like, you've come to me, we've had previous, appointments after we've been finished through the program where we're now addressing other stuff that doesn't have anything to do. Yeah, it doesn't have anything to do with the anxiety and the OCD anymore, because you look at me and you're like, you already taught me what I needed to know. We're good. If I need to do better in that area, I got to step it up in these places because you have the pillars for success. I don't need to sit there and say to you, you know, well, did you do this? It's like, no, you already know what you need to do. We can already go those 10 layers deeper and be like, let me penetrate your mind and do whatever weird voodoo I need to do on you. Right? So I would say, like, that message that you gave there is so important, which is take the thing if it's going to help with the symptoms so that we can reduce symptoms enough so that you can see this progress everywhere else in your life. But you have to be doing that self-work on a majority basis. The fact that you were so consistent and did 7 days, again, poster child, hello, but not everyone who does my program is that intense. They don't do, you know, the things as often as you did, with the diligence that you did, with the, think about the length of time you've been doing these things. I mean, granted, they work for you, so you want to do them, but look how consistent you've been since we started.
And I'm still doing everything
Yeah.
too. I finished the program in what, November, December? Like, it was, yeah. And I'm still doing everything.
Yeah, consistency is key. All right, so let's pivot right now to, we talked about the meditation, we talked about the mindfulness. Let's talk about the breath work, because you love the breath work.
I love the breath.
And then let's talk about how the yoga component kind of helped with the physical discomfort of the feeling. Okay, so do the breath work first.
Breath work. I love the breath work. I don't know why. I just feel like it works so well for me. And it's something so quick that you can do in like your everyday life. Say like you're somewhere and you get like these anxious thoughts or the OCD tendencies coming up, and you don't have time to just sit there and go through like a meditation or whatever. So the breath work is great because I do it all the time now. Before a job interview, I'll do breath work to calm me down. When I'm at the store and it's like there's so many people around and I just get anxious, I do breath work. And it's just such an easy thing to take with you every day that you can do everywhere, and like for as long as you want. You can do it like 5 breaths and you're good to go. So
yeah,
I feel like
there's never a time where it doesn't work.
Yeah.
Like, no matter what, scientifically, if you're going to do breath work, your heart rate's going to change, your blood pressure is going to change no matter what you do. So it's really one of those things where it's like, when people are like, well, did you focus on your breath, or like, did you do the breathing? They're like, yeah, I tried it, but it just didn't help. It's like, hey, like, just do it for 5 minutes and then like, let me know. Right. Again, this like instant gratification thing. I don't know where we've been taught that like you can do anything in this world and it's just going to immediately fix everything. Like, aside from having an anaphylactic reaction and putting epinephrine shot into your leg, like what works that fast in this world, right? So no matter where you are, even if you're having the compulsion and you're like choosing inside, I actually really don't want to do this right now. I don't really consent to doing the thing. I'm going to sit with my breath instead. And I'm going to allow the breath to help me pass the moment because I already know and have confidence the moment's going to pass. All I have to do is breathe through this moment and know that the light is on the other side so that I can prove to myself once again that I can choose.
Yeah.
Right.
And
so
it's a
that's
distraction too, right? You forget what you're kind of were worrying about in the first place because you're focusing on your breath.
Yeah, I mean, it's not really a distraction. It's more so a refocusing of the mind. I mean, we can call it whatever we want. A refocusing is always a distraction. When I tell someone to, focus on relaxing the center of their eyebrows, that is a redirection. It's a distraction of the mind to increase focus, right? So breath work, you loved, super easy. Anyone can do it. Obviously, the techniques that I use are a little bit different so that we are actually seeing those results on the other side. The breath work that I choose, some of it's super simple, some of it can be really helpful in certain situations, and some of it's very helpful in different situations. I don't want you to.
Sorry, that there's different options that you give people. So you can find what works for you and then go with it, right?
Yep.
Yeah.
So now, aside from that, let's talk about the yoga a little bit, because that was not something new to you. You'd practiced yoga before, but it was different when you practiced it with me. So how did the yoga portion of the program, how did that shift your experience of being inside your body in a physical perspective when you were going through those moments?
Yeah. The yoga was definitely like more challenging than like anything I've ever done. And I wasn't expecting less from you, but it was just I think the hardest thing is holding the poses for like a certain amount of time, right? And it's just.
And I explained in the program why I do that, right? So we're in the session and I'm doing the yoga with you there on the screen. And what is it that I'm teaching you when you're in that pose for the long amount of time? Because that's one of my favorite things is to make you hold. Why am I doing that to you?
You're trying to like make us be still and just sit with something that's bothering you and just keep holding it and until you say stop. Yeah.
And precisely that. So I'm teaching you how to sit with your shit, sit with the discomfort. Some people, obviously with anxiety, meditation is going to be harder. And with the OCD, it's going to be harder to sit in stillness. But some people also don't like feeling physical discomfort either. Mm-hmm. Having your heart beat out of your chest, or being short of breath, or having a stomach ache, or whatever it is that your anxiety symptoms can create. It's the same thing as your legs burning when you're in chair pose or a runner's lunge. And if you can take that skill and be like, well, I was uncomfortable there, which was actually a lot more intense than the thing I'm feeling right now, or maybe equal. But if I did it there, why can't I do it here? Mm-hmm. And I think that once there's so many different learning lessons. You have to learn it in your mind, you have to learn it in your body, and then you have to learn it with the things that are going to be the tools that help cope. Yeah. So the meditation component is the mind. How am I going to sit with the stillness in the mind, deal with the discomfort of the stillness? How am I going to do that now when I have physical sensations? And yes, physical sensations can be created in meditation. I am one to know, but when you are in yoga, it's a little bit different. So, a lot of people always say to me, well, I've never done yoga before. And I'm like, don't worry, I'm not going to make you stand on your head. We're not doing that. I'm going to torture you. And it's all good because that's what you're here for. Yeah. Right. So it's about a different way to learn how to apply the discomfort in other areas of your life. Okay. So I think right now I've covered basically everything that I wanted to talk about in regard to OCD. I want to know if there's any questions from anyone who's listening live. It can be about anxiety or OCD in general. They can be for Carly, they can be for me, just so that we can make sure that we covered everything that you wanted to talk about. While people are typing, you can do that in the chat or in the Q&A. I'll also check the Q&A section, just so you know, depending on where you want to put that question. And Carly, why don't you share with everyone, because at the beginning of the program, we take your anxiety scores, and I do that with a certain type of questionnaire. Yeah. So let's talk about what the score was from the beginning, and let's talk about what your score was by the end of the program, just so that people can see how dramatic the shift was when you actually did all of the work from all the angles.
Okay, let me get them up here. So that was most recent. So on the GAD score, I was for most things, I was the highest rating. And like feeling nervous, anxious, or on edge, I was the highest. Not being able to stop worry or control, to stop or control worrying, same thing. Trouble relaxing, worrying too much about different things, being restless, becoming easily annoyed or irritable. And then this one, obviously, feeling afraid as if something awful might happen. And those are all things I struggled with, and I was like the highest on the chart. I struggle with that a lot. And now at the end of the program, you redo the GAD and see how your scores have changed. And I will get that. Okay. So yeah, for a lot of things, a few of the things went down to 0. For example, being restless, that it's so hard to sit. I'm fine with that now. Becoming easily annoyed or irritable, that has changed for me a lot too as well. I'm very low on the scale now. And feeling afraid as if something awful might happen. Now I rarely think about that. And then the other things, obviously, like feeling nervous or anxious, it still happens to me, but I am lower down on the scale, as well as like not being able to stop or control worrying. That is also lowered for me on the scale. Not like perfect, but like a huge difference from like when I first started.
Now, what was the number difference? So the score initially.
There, I was 3s on everything, which is like the highest.
And then, when we add those up, that's 21. The score is 21, right?
And yeah, 21. And then I had, let me see. And then on the last one I did, I had 3 2s, I had a 1, and then I had 3 0s.
Yeah. So you went from a 21 to a 7. So we were able to see like that's like a even greater than 60% decrease, even more. Mm-hmm. So like that's 3/4 or however many points we dropped down there, but that was a huge difference. You went from like severe anxiety down to mild. So that was pretty wild for me to see. Usually I always say to people, yeah, like a 50% decrease is like really amazing. Like if we can see symptoms and, perception of stress and anxiety and whatever the presentation was for you, if we can see that drop at a 50%, like that's amazing. And when you exceeded that for me, I was like, whoa, because like I never expect, people to be as diligent. There's always that the discrepancy between what people think they're doing and what they're actually doing and the efforts that they're putting in. So your score drop was a complete reflection on all the effort that you put in and how diligent you were. So public congratulations for that. Not that I've given you a billion private congratulations, but there's your public one.
Yeah, thank you.
Yeah. And now, I mean, at the beginning, I think before we were live, I talked to you about how the OCD tics changed from the beginning to the end. So we already know what it was looking like at the beginning for you. And just tell us a little bit more what it's like now. Right now, if you were to say like, how's your OCD? Give us the level of management control that you have over it and what things you are noticing that you were able to drop completely.
Okay. So I want to start with, you said something to me before, and that just like, it just made me realize that, okay, I'll tell you what it is. So you said mental health is a forever practice. And I feel like that is super important for people, because coming into this, I was like, oh, like it's going to be gone. Like it's going to be awesome. Like whatever. And then you actually putting into perspective and being like, you have to put in the work. You got to do this and this. And then me actually following through and doing it. Obviously, I saw huge results in the program, but it's something that I know I need to continue doing every day. And I was talking to you before, and I have like my to-do list every day, and like I have it here.
Because she has OCPD, she has a to-do list, just in case you're wondering. Yeah. People who have OCPD love lists.
I love lists. I have lists everywhere on my phone, written down everywhere. Okay. So I have a weekly planner. Okay. And this is part of the program too, just like knowing what things you want to continue doing for your mental health and the things that you don't want to keep doing, right? What worked for you and what didn't, type thing. So I have my non-negotiables every day, and that like involves my meditation, my breath work, mindfulness, as well as going outside for however long as I can. Obviously, it's cold here, but just
Nobody cares.
yeah, I know, just get outside. It really, it's amazing. And then what else do I do? I have my supplements every day, and then as well as getting in some type of like physical activity. And those are the things that I know like I need to do every day. And I've honestly like stuck to them.
Yep.
For a while. It's been like 3 months since I finished the program. I've still done those things every single day. You will, if it's important to you, like you'll make time to do it.
Mm-hmm. So that's Carly on her end. She's doing all of the back end work. And then there's on my end where we're treating the OCD and the anxiety from a naturopathic standpoint, right? Because we can only see that progress and that level of stability when we are treating the symptoms so that it gives us that ability to do all those things. So yes, Carly right now is being treated for her anxiety. We do have her on plant medicines for that. And we have her on different stuff for the anxiety and different stuff for OCD. So I don't want anyone, I mean, anyone can always go and do their own lifestyle stuff and be like, yep, great, I got this, I can do it. But like, I don't want Carly to sit here and make you feel as though if you just meditate, everything's going to be great, right? She's doing a lot of things, and she's also doing continuous treatment with me where we are working on keeping her in that stable place and working on the baseline of anxiety and depression, not depression so much for you, but the anxiety and the OCD, so that she is able to stay consistent and still feels that progress moving forward and feels confident in herself that she can do it, right?
Sure. And I know this is going to be something that I'm going to be doing for a long time, and you just have to like,
commit.
That's the biggest thing, I think, is to commit.
So we have a question here. Is this for both of us, Mandy? Do you take anxiety medication? I'm back on medication, but I hate having to rely on medication, and my end goal has always been to get off of it. I have helped lots of people come off medication if that's what they wanted. And then there's lots of people who came to me not on medication where we put them back on it. It really depends on, you know, what your goals are. And I think that there's a lot of judgment around different treatment styles. And what I always love to tell my patients is that a tool's a tool. Like if you need to be on meds for a little bit so that we can get you to a place where you feel confident enough to be off of them, then that's the path for you. And different tools can be used, and maybe medication isn't working as well for you the way that it works for other people. And maybe you need to be doing some things at the same time as being on medication to actually see those results. Like I said, mental health, multifaceted, so many different layers to this kind of stuff. So it's a reasonable goal to want to be off medication, but also practice non-judgment or feeling like, you know, you need to rely on them. Like you don't need to rely on anything except for yourself. And that is, I think, an empowerment message that needs to be given when you are a patient. And I think that a lot of doctors shit the bed and screw the pooch on giving their patients that level of like confidence and empowerment in themselves that they are in charge and they are in control and they do play a very big role in their mental health, and that a tiny little pill is not going to fix the world for them. Some people it works, congratulations, really happy for them, but like most of us, it doesn't. So that's something important to remember. Okay, if you hate having to be on it and it doesn't resonate with you, then that's not for you until you maybe feel that it is right for you. And if that, you know, perspective changes over time, then that's the perspective shift that needed to happen. And if being off meds is what you want, then you can make that happen. Like, please, I'm going to feel free to reach out to me after. I'm going to tell you guys how to do that. But I want to make sure I get through these questions. I did group therapy. And though I was thought I was fixed, but some life situations happen. And now my anxiety, depression, and OCD is back and it sucks. I'm taking a break at work. Yeah, you know what? This is exactly what Carly just said. Mental health, the condition that you have is forever. I'm never going to be a person without anxiety or depression. That's who I am. It's a part of my actual soul. But that doesn't mean that it has to take over at times where I don't consent it to. And I think that when we get to a place of like overwhelm or high levels of stress, that's where it attacks or it comes back, but we're never healed from it. And that's something that I guess I differ from a lot of other professionals out there on social media and whatever. People are like, you got to heal yourself. I'm like, it's not about healing yourself. It's about accepting yourself so much and being so comfortable with who you are that the slip and the dip doesn't matter. Like I talk about in my program, mental health blips happen all the time. It's about how you approach it and how you sit with it each time it happens. I'm never going to sit here and tell someone I'm never going to have a depressive episode ever again. Like my life is the same life as other people. I'm going to go through things in life. Shit's going to happen. Am I going to slip into a depressive episode? Sure. Like the last time that I can say I was scared of a depressive episode I was in was like 4 years ago. That I was scared because I didn't know when it was going to end. It's like, okay, but when you start putting and implementing the things that you need in place, it's like you look back and you go, oops, I wasn't doing the things that I needed to do to support myself before that happened, and learned how to engage with it in a dark place. I think that people are so afraid of like what happens when anxiety gets bad, or what happens when depression gets bad, or in this case, when OCD gets bad. It's like, you're going to be fine either way. It's all good. You just need someone on your team to help support you and teach you how to be inside that space without it taking over you and your intellect and your choices and the way that you want to live, right? So that's what I would say is you were never fixed. And if you have that thought that you're fixed, that means you're in a fixed mindset. There's no growth mindset. We don't want to get stuck and stagnant. And I don't ever want people to be on this like exponential growth pattern. Like that's exhausting too, high achievers. Everyone's always like, I need to get better. It's like, no, you don't. You're okay where you are. And that's where I work with people.
Yeah.
Is practicing
can
that.
I add something?
Yes.
So another thing, because I didn't answer this in your last question about like, do I still get tics and do I still have my tics? And I think that's another thing to like, I still get them, obviously, but it is a lot more manageable than like when I started the program. And now I can actually like live my life without like spending 2 hours a day flicking the switch, making sure my room's perfect and all that. And yeah, it's just like I've come a long way, and like I noticed that, but yeah, I still do struggle. I struggle with anxiety. I struggle with my OCD tendencies still too. It's just it
is who you are.
Another end of the spectrum now.
Yeah.
Yeah.
And that's, I always tell my patients, I still have anxiety. I will still have depressive episodes. I will still show up when I'm in those places. And I'm not afraid to share what I'm going through and what it feels like and what the experience is like, because I can practice non-judgment while I'm inside of it. And that's the thing, is we don't want to get rid of that part of you, because then you wouldn't be you.
Yeah.
And that would take away so much from who you are. So I think that we need to stop hating on these things that we think need to be fixed, and instead turn our intensity into learning how we're going to be with the thing that makes us who we are.
Yeah.
And you might think that you don't like that it makes you who you are, but like, trust me, if I took it away from you, you'd lose a lot of good qualities. Someone else asked, what kind of supplements are recommended for anxiety? I can't actually talk about what supplements I recommend for anxiety. You can give a little bit of insight into a few things that you're on for yourself. Just to answer that quickly, because again, I'm not telling you what to take, but Carly's going to tell you what she's been prescribed by her doctor, who happens to be on the call.
Okay, so I'm currently taking ashwagandha, as well as magnesium. I think those are the only two I'm on now for my anxiety. I was on more before, but I kind of leaned off a few of them just to see like how I would react to them. And I think I found where I like.
And that's how I always work with my patients, is I never say, okay, you need to be on this thing for the rest of your life. You know, you have anxiety, so you got to be stuck on this. We find what works well with your body and with your symptoms. And then you start getting to decide, what did you feel that worked the best for you? And what do we want you on long term, so that we are keeping that stability, instead of falling into this trap of, I need to be on all these things. And now, instead of being reliant on pharmaceutical medication, I'm now reliant on natural medication. It's like, you are doing so much work at the time that you'll be able to streamline where you need things. I'm at the point where I will do a treatment protocol to see if it affects a different symptom, and then come off of it and be like, you know what, I'm actually starting to feel this symptom pop up, and then I go on another natural medicine. Obviously, it's easier because I have the knowledge and I get to play around with this kind of stuff. But I do that with my patients too, is I say, you know, let's play around and see if you're feeling good and feeling stable. What if we pull back from that? Are you still feeling as good? Because if you are, and here's the kicker, maybe we've actually regulated your nervous system enough so that your anxiety is reducing by itself, right? And like, someone left a comment here or a question, like, my body feels nervous when my brain isn't. And that's where I tell people that your nervous system is dysregulated, and it's creating symptoms because it doesn't know how to balance itself. And all we have to do, my job as a doctor and your job as a patient, is how are we going to work together to regulate your nervous system so that you've recreated your homeostasis and your balance, so that your symptoms aren't happening, right? Again, I don't want you on those things long term if you don't have to be. But what we do have to do is get you to a place where we get that balance quicker, so that your nervous system relearns as fast as possible so that you feel better as fast as possible, right?
Mhm.
I'm here. Okay. What you're saying makes so much sense. I hope it makes a lot of
Yay!
sense. I hope what I'm saying makes so much sense, because listen, I did not do this for years for no reason. Like there is so much self-knowledge that you gain when you are someone who has anxiety and depression and you start doing these things, and then you see the changes and you're like, whoa, what is that?
Mhm.
Right? And that's why the program is so simple, hard, but simple. But like, it gets you results on the other side, because I'm sitting there looking at you being like, you doing it, you doing it, you doing it. And then suddenly your brain has a moment where it goes, whoa, something's different. Something's changed. My perspective has changed, but I don't really know how that happened or why that happened. How many times, and I know that we had like sleep issues with you at the beginning, but like people start working on their nervous system and their anxiety during the day, and suddenly their sleep is like completely repaired. And then suddenly their anxiety during the day starts feeling a little bit different. And people are like, what's happening here? I'm like, you're regulating your nervous system and your hormones. So obviously things are going to start to change and shift. Okay. Someone's asking a question, where can I find ashwagandha? You can get ashwagandha anywhere, except I would prefer if you don't go on Amazon. I'm not allowed to talk about dosing for certain plants because I'm not allowed to give out an actual recommendation live if you are not my patient. Ashwagandha can be super helpful for some people, but it is not always great for everyone. I have patients who have had terrible reactions to it. So I don't want you to think that you can just try things and everything is going to be a-okay and you're good to go and it's going to fix everything, because you might try ashwagandha, it doesn't work. And then you're like, well, I guess I have treatment resistant anxiety and then, nothing's going to work for me. And it's like, maybe it wasn't the right thing for you. Right. And that's my job, is I get to sift through the what's right for you territory while you're giving me the feedback of how you're feeling. And if you told me, my symptoms have decreased by 15%, but I want a 30%, then that's when I get to start stacking things. And I get to start interacting different plants with one another, which you also, if you are listening right now, you should not do. You should not be going to the store being like, you know what? I like natural medicines now and I'm going to pick all these things. You have no idea what kind of reaction you're going to have. I would not play around with that kind of stuff. Just because it's natural doesn't mean that it's safe, and it doesn't mean that it's healthy, right? So we need to be careful when we are selecting what it is that we're doing, right? For example, the milk thistle that you're on for the OCD, I have other patients who have gone on it and have had diarrhea because their body can't tolerate it. Or people start having different symptoms. Maybe they start getting headaches. You guys don't know what pathways these are working with. And that's what my job is as a doctor, right? So we don't want to just go to the store. You wouldn't take yourself to the store, anyone who's listening, and just be like, hey, can I have Cipralex over the counter? Just no. Would you guys take an antipsychotic over the counter? No. So I don't know why we love to play around with like an antidepressant or an anti-anxiety over the counter because it's a plant medicine, right? So that's where I sit in this territory of like, yep, some things can be super gentle, but then there's also things that are not gentle for your body and you don't know. And then there's times where your anxiety is so bad, if I'm working with someone, that I don't want to give them something gentle because they need a lot more than that. Right. So that's not something that you can just be going to the store and being like, oh, I'm going to take this anxiety blend and I'm going to feel good. It's like, you might not. And that is, it's not a good place to be in, because then you have no care and support. Right. So here's what I'm going to tell you right now. For those of you that are still listening, I'm going to pop a link into the chat right now so that if you do want to talk to me about next steps of how either we can work together or what things that I think that you need to be doing moving forward to help with whatever symptoms you have, then you can have that chance to book a call with me now. So I'm going to pop that link in here. I call this the anxiety and depression breakthrough call. It gives me an opportunity to meet you, talk to you, learn what it is that you're actually going through, and see if we are a proper fit, right? Like me and Carly got on the phone the first time, and immediately all I could see in her was, this girl's actually going to do everything that I'm saying. So if she's going to do it, of course I want her in my program. So that's something that we need to, address is, are we going to be a good fit together? I did the hand motion again. Are we going to be a good fit together? Are you going to do the things that are required of you to see the results in this type of way? Or are you, going to ask me about what pills you can take and not do any of the lifestyle stuff? And I'm going to have a little bit of a challenge with you as a patient, right? And the way that I work with people also depends on where you live. because I cannot just see anyone everywhere all the time. So if you do want to speak to me and talk further about the program and about what kind of care you're looking for whatever mental health stuff you're going through, then I would suggest that you grab that link there. I'm a dodo and didn't fill my schedule with what I have going on next week. So if you book a call and it's outside of a time that I, already have someone booked, then I will message you. But, feel free, go book your call now just so you get it in there and hopefully you land in a good spot. And I will hopefully talk to some of you soon. Do we have any other questions before we close here? I think I missed a question back up top. And I think it was a little bit of an extension to anxiety, depression, OCD, and then struggles with food. I would highly recommend that if we have, any other mental health stuff, that me and you, whoever left that comment, to keep that in our chat. If you want to book a call with me and talk about that. But OCD, anxiety, depression, addictions, it's all behavioral stuff, right? It's all our way of latching onto something and then just giving into whatever desire or the discomfort is of the moment, right? The same way that you would be, loving food and having that obsessive relationship with food is the same as Carly flicking the light switch right now, which I'm staring at in the background the entire time you've been
Not tempted.
But that is exactly the same thing. And if you have a poor relationship with food and using it to cope, then you need coping mechanisms so that you're not reaching for something that feels undesirable for you, right? So the same thing. Let me make sure that I'm catching everything here. Did I answer everyone's questions? Are we good? I'm going to check the Q&A just in case no one put anything there. All right. So if you have booked a call with me, super happy to chat and super excited to talk with you. Thank you so much, Carly, for coming on and joining me today.
Thanks for having me. That was fun.
My pleasure. And if anyone has any questions about OCD that we didn't cover today that you think about later, feel free to send me a message. I will answer. As most of you know, I love to get to know the people in my community. It is one of my greatest joys in life because I love connecting with people and supporting people when they feel like they really have no one on their team or feel like they have the right person on their team to help them make moves. Okay. So it was lovely to have all you here with me. Carly, again, thank you so much for being here. Thank you for being the poster child of OCD in my program.
You're so welcome.
And hopefully you inspire some people to start making moves in a different area and have a different perspective on their anxiety and their OCD. Okay.
Awesome.
All right, everyone. Ciao for now. Bye-bye.
Bye.